ethical is mandated treatment for criminal offenders? Imagine being told you have to do something that affects your freedom and choices. That's what mandated treatment for criminal offenders often involves. It's a topic that sparks many questions about rights, safety, and fairness. When someone commits a crime, especially if they have a substance use disorder or a mental health issue, courts sometimes order treatment instead of or alongside punishment. The goal is to help the person recover and prevent future crimes. But is forcing someone into treatment really fair or ethical? That's what we need to explore. One of the biggest concerns is whether offenders truly agree to treatment or if they're just compelled to do it. Informed consent is a key part of ethical treatment, meaning people should understand what they're agreeing to and do so voluntarily. With mandated treatment, their freedom to choose is limited, which raises questions about coercion. However, some research shows that many offenders don't see it as coercive. They might even want help but feel they have no choice. When treatment providers are caring and respectful, offenders often respond better, and the process feels less like punishment. Another ethical issue involves balancing the rights of the individual with the safety of society. Courts and treatment programs must decide how much to respect an offender's refusal of treatment. For example, with serious offenders like sex offenders, some treatments involve controversial methods. These can include behavior modification or even surgical procedures, which raise serious ethical questions. Transparency and honesty from treatment providers are essential to ensure offenders are aware of what they're agreeing to and that their rights are protected. The effectiveness of mandated treatment is mixed. Some studies show it reduces reoffending and substance use, especially when combined with specialized programs like drug courts. But other research finds little difference between mandated and voluntary treatment. Sometimes, forced treatment can even cause harm or increase the risk of reoffending if not done properly. The quality of treatment, the environment, and the individual's needs all play a role in how well it works. From a criminology point of view, mandated treatment can help divert offenders from prison and address the root causes of their behavior. It can lower prison populations and reduce repeat crimes. But ethical concerns remain, especially if treatment is too harsh or lacks safeguards to protect human rights. It's important that treatment is delivered with respect, clear communication, and a focus on the person's dignity. To make mandated treatment ethical, it should include informing offenders about what to expect, providing a supportive environment, and regularly checking if the treatment is working. Offenders should understand the goals and limits of confidentiality. The balance between respecting their autonomy and protecting society is delicate but vital. When done correctly, mandated treatment can be a helpful tool for rehabilitation and public safety. The key is to avoid coercion and focus on genuine care, making sure the process benefits everyone involved.